Thank you for coming in today. Before the doctor sees you, he's asked me to do a test, a cervical and a full spine temperature scan of your back.
Okay.
The reason we're doing this is that the same way a medical doctor kind of looks and takes your temperature to see if anything's amiss, fever, whatever. A chiropractor uses temperature as well, and even more precisely, because we're going to look across your back for symmetry, for temperature symmetry. And what research has shown for almost 100 years now is that if your nervous system is working and functioning properly, your body will maintain temperature symmetry across the spine within a very, very tight control. And even within that control, it will always be adjusting. You're adapting to your environment. And that means your nervous system is functioning, your brain is talking to all the parts of your body that it needs to help healing if anything needs to be healed. Okay? And what happens is if there is a misposition of any of the vertebrae, it puts the body in a stressed situation, the flight or fight response. And that's what causes some temperature differences in the skin on your body. And when we're in a stress condition, where that fight or flight response, we want to conserve blood and energy for the muscles so you can run away from that leopard that's chasing you. You don't need to be digesting your lunch when you're running to save your life, okay? So any stress, like in today's environment, there's a lot of stress on people, and it puts your body, it can put your body into that fight or flight response as a subluxation sets in. And a subluxation is merely the disposition of two vertebrae from each other. Do you ever get a piece of popcorn stuck in your teeth?
Yes, very annoying.
And it bugs you.
Oh, yes.
Okay, until you remove the popcorn. The teeth go back to the position that all the nerves around them expect them to be in, and voila, everything is happy when the popcorn is removed.
Yes.
The doctor's adjustment, in a similar way, if there are vertebrae that are out of position just slightly, and it takes sometimes a precision x-ray to really see this, but what happens and what can show it, even if it can't be seen on an x-ray, is that it puts your body in that same fight or flight a little bit that popcorn did in the teeth, except this time you don't get to feel it. Those sensory nerves around the spine do not track to a pain center. You may feel like $1,000,000 and have, quote unquote, a piece of popcorn somewhere, okay, that will eventually cause a problem.
Okay.
So what I want to do is scan you and see if you're in balance.
All right.
Okay? And that will be very key to the doctor. So if you would sit down. And I've opened up your ground. We're going to start with your bra on. And I'm going to put you into the computer. So we will just load you in as a new patient. And we are ready to go. Those that measure distance, so that I will be able to make a graph on the computer screen that's a one-to-one correspondence to your spine. Because we're going to look at differences from visit to visit and be able to compare them on the computer. I'm going to start by doing a cervical scan by placing the barrels just a little below T1. And I'm going to scan up your spine, keeping the barrels balanced across the spinuses. And as I approach the hairline, I'm going to slow down and use those barrel tips as little snow plows to push the hair forward. And I come up to the occiput, and I stop, and we have a graph. If you could turn around a little. This is the temperature on the left side of your spine. This is the top of your neck. This is where we started, just below T1 in your cervical area. Temperature on the right side. And this graph represents the difference between these two sides. What we look for is for this graph, this middle one, to be inside of two vertical lines, which represents 1/2 a degree centigrade, and always different, okay? And we're always looking for a warming trend as we go up your back from the lower back to the cervical area. So I'm going to save this graph, and I'd like to do another one while we have you here. I'm going to, again, start about here, and we're going to graph up. When I do hit the hairline and slow down, even if a little hair gets under the barrels, by moving slowly, I'm allowing that hair to come up to skin temperature. And we have this blue line is the graph I just took. And as you can see, there is some similarity between left and right. The middle has some similarity here and a little difference here. And that's good. You're adapting, you're changing. One graph by itself does not mean a lot. Now I'm going to save that. And I want to do just one more. So we have 3 cervical scans. Normally in an office visit, we'd like to have a little time on a first visit between these graphs, maybe 15, 20 minutes while you talk to the doctor's assistant about how the office operates and days and hours of operation. And so we have another graph. And as you can see, the consistency and repeatability is there, and we do like to see a little change going on here. Having taken these so close together doesn't tell us a lot. When we take some graphs on your next office visit, that's when we really have an opportunity to see if you're locked up in an asymmetrical, hyper-sympathetic, nervous situation. Okay? If these are always different each time and fairly straight, you are in good shape.